Hi, my name is Steve Eady. I'm with the Sauk Valley Voter Education Forum, and in a couple weeks we'll be having an event. And beforehand, we're interviewing candidates for various positions, and a chance for them to answer questions in advance that'll be posted on YouTube. With me today is Brad Cole. You're currently a mayor.
Correct.
And you're running for lieutenant governor on the Republican primary.
Yes.
And we want to welcome you.
Thank you.
And we gave you a list of questions beforehand. And I'll just delve into the questions right away.
Okay.
The first question has to do with our budget. Now, Illinois recently was actually downgraded by Moody's from A1 to A2, and we're only second to California in worst ratings of all states. So this is an interesting election year for people running for state office because we have a budget deficit of $11 billion. It's 35% of our expenditure is deficit, and it's really scary when you think about the amount of debt that our state is carrying. So I guess I'm leading the question here because, A, do you think there is a budget crisis in the state of Illinois? And if not, why? And if so, why?
Well, the answer is obviously yes. We have a couple of different variations on the problem. First, as you mentioned, we have a deficit in the operating budget, which is the annual ongoing budget. On top of the fact that the General Assembly hasn't been able to pass a budget on time since probably 2000, they haven't done a balanced budget in a number of years. And as a mayor, one of the things I have to do is balance a budget. We have to balance it on time, and that's not happening in the state. On top of the anywhere from 10 to 12, $13 billion budget deficit, because there's no real clear number, we also have a mountain of debt that is on our shoulders and on the backs of future generations in Illinois for pension obligations and for long-term and short-term borrowing that some people have estimated to be upwards of $75 or $80 billion, depending on how you calculate the pension obligations. So clearly there is a problem, and I think we have to get that under control. That is by far our biggest issue right now.
So what needs to change? If you're elected lieutenant governor, obviously there's influence that you have
right.
in the budget process, consulting with the governor, and what needs to happen?
Well, first of all, I think just about everybody in state government needs to go as far as in a leadership capacity, because they've failed to make good on the promises that they kept or that they made to people. They haven't kept those promises, which is to do the people's work and to do it with honesty and clarity. We're not balancing our budget. We're not doing the things we need to do. The bills are going unpaid for hundreds and hundreds of days. Small businesses are struggling to make their payroll because they have reimbursements that haven't come through from the state for months and months. But I think what we need to do is ratchet back our spending. We have to take a look at all state programs. The Auditor General released a report a couple of years ago just looking at 50 different programs. They estimated that there are almost 1,800 state programs in Illinois. Looking at 50 of them, they found that many were duplicated by different agencies. So you may have out of those 20 programs that were being conducted by 3 or 4 different state agencies. So there's a lot of duplication that needs to be pared down. But we have to stop the spending. That's first. We have created, the last administration created several new programs without any funding mechanism, so they just thought, let's just create new programs and we'll worry about paying for them later. We have to probably go back and eliminate most of those, take a look at the programs and services that we're offering, and make priorities, and realize the government can't keep doing more. We can't keep doing more for less. We just have to start doing less. And we have to back out of people's lives and do the things that are required. We have to make good on the promises we've kept to pensions and to our employees, and we have to provide for public safety and the public welfare, but we have to start saying no to a lot of programs and cut the spending. That's the first thing.
So let me just stop you there because I follow up on that. I mean, here's the million-dollar question for anybody running for office. How do you win an election by telling people you can't have these things and those things? Because a lot of times people think it's just an endless amount of money that comes in, and they can,
right.
and as long as it comes back to them,
right.
if it's coming to me, it's pork, but if it's coming to someone else, it's good.
Right.
So how do you get elected if you're going to say we can't do these things anymore?
Well, you might not be elected, and that's one of the risks that I'm running, because I'm telling the truth and I'm talking the straight talk and saying that we have to tell people no, and people don't like to hear that. But we have to make cuts. We just cannot do this. I mean, it is that simple. We cannot continue to do the things we've done. And so we have to make tough decisions. And if those people that are saying these things, like myself, don't get elected, then we're going to end up with the same kind of failed leadership that we've had for the last decade or so. And, you know, it's really not an issue of getting elected. I'm not running because I want to tell people what they want to hear. I see in my city, as a mayor, the things that are causing problems on Main Street with the businesses, you know, with my neighbors and with the city government and with the state and federal governments as well. We have to address the problems. If people don't want to hear it or they don't want to agree with it or try to solve it, that's fine, that's their choice. But we just have to make some of these tough decisions. There's just no choice about that, really.
Well, one of the tough decisions that kind of gets forced on the state that you'll have to deal with if elected is the idea of this healthcare reform bill that's passing and the stress it'll put on Medicaid.
Right.
Medicare, which the state funds partially of the Medicaid, so
right.
that does come into play in the budget in the state.
Right.
And I guess, what are your thoughts on the healthcare system today? What are your thoughts on the healthcare bills that are being proposed and actually passed in both houses, but now they have to amend them to get them to agree on one? What impact do you feel it's going to have to our state, and what are your thoughts on our healthcare system?
Well, I think, first of all, we're spending billions of dollars in Illinois on Medicaid, and it is hugely fraudulent right now. There are extreme cases of fraud that are just throughout the system because physicians or others, providers, have found a way to double bill or to bill for services that aren't provided because the system is so big. So we have to attack that. There's a division of the Illinois State Police that does Medicaid fraud. They need to be strengthened, have more people out there trying to counter that. This healthcare bill that's been through Congress and through the House and Senate, I don't know what's going to come out of conference with them. It may be just as difficult to get something approved as the first two versions. But we absolutely, I think, are going down the wrong path with that. We can't go to a single pay provider system. I don't think the talk of socialized medicine is what we need. I also think there's a lot of unknowns about what's been discussed, because you have a bill or two bills that are hundreds or thousands of pages long that nobody has even read or understands. In Illinois, we have extreme issues with our health care. The good part is that we have some of the best health care anywhere, and there is access to health care in some areas. The private system, which provides for physicians and services to be out there and to be expanding their reach and to provide the best care that they can, works. In Illinois, as a rural state, we have a lot of areas where there are not physicians. In my city, we are fortunate to have a cancer treatment center and a cardiac center and neurologists, but if you go outside of us, you won't find a physician that will deliver a baby. There are no OBGYNs for 50 miles. Well, you're crossing into other states at that point. And there are areas in northwest Illinois and central Illinois where there are not physicians to care for people. Or if there are physicians, there's not transportation to get folks, and particularly elderly patients, to some of those care providers. So there are a lot of different issues that Illinois is facing. First of all, we have to address the Medicaid because it is consuming $8 to $10 billion of our budget annually. On the national level, I think we need to pay attention and not go the direction where it's heading right now. I think that's going to be disastrous for us. And it's not going to be able to provide incentives for physicians to go out and care for people or to get educated to learn some of the specialties. So there's a lot of different things going on. I think rural health is a big issue, and it is an area that Lieutenant Governor can focus on.
Okay. We're going to change a little bit to energy dependence and independence. Illinois is fairly rich in resources.
Yes.
We have a lot of coal. I've heard recently, read a report that we actually have some oil reserves.
We do.
We have nuclear, which a lot of other states do not have or have very little. We have quite a bit. We also have wind farms up here in the north and some in the south, and we also have biodiesel and ethanol. And I guess the question is what can we do in the state of Illinois to help reduce our dependency on foreign oil and to build up, I guess, the energy sector, a private energy sector in the state of Illinois?
We have a lot of natural resources here. You mentioned coal. Coal mining had been a major industry in central and southern Illinois for decades until the Clean Air Act, which